Every day, across the country, patients are having surgery. It may be for something as small as removing a little segment of infected skin, to something as complicated as repairing an open heart. No matter the surgery, there is always someone there that is dedicated to protecting, monitoring, and relieving the pain of the patient. Your anesthesia provider. LifeLink Anesthesia's mission is to change the status quo of healthcare by providing high-quality, cost-effective services to our patients. Patient safety, trust, and evidence-based clinical techniques are the foundation that allows us to consistently exceed patients' expectations.
Hello, my name is Jason Crosland, and I am LifeLink's Director of Acute Pain Services at NorthCrest Medical Center. Over the next several minutes, you will learn how LifeLink Anesthesia is utilizing regional techniques to help reduce your surgical pain during and after surgery.
What is regional anesthesia? Regional anesthesia is the use of a local anesthetic medication to block a nerve or group of nerves in the body. You may hear your nurse refer to regional anesthesia as a nerve block. They are the same. Regional anesthesia is used to reduce pain, decrease the use of narcotics, and allow for better patient outcomes. All patients start here, the pre-op area. It may be a small room or a slot in an open bay with curtains. Here, you will change into a gown, have vital signs taken, and be asked questions about your medical history, and receive an IV. If necessary, you may have blood drawn for labs, or be asked to give a urine sample. You may also be given medications from your pre-op nurse to help prevent nausea and aid in pain relief. After your time in pre-op, you will be brought here, the block area. Here the block team or your anesthesia provider will place the nerve block. In some facilities, your pre-op area will be turned into a block area, or you will be taken to a room dedicated solely for regional anesthesia. You will be connected to a vital sign machine and given oxygen via nasal cannula. You will also be given medications to relax you during this time. Many times, patients will still be able to communicate with the block team during the placement of the nerve block. Sometimes the patient will fall asleep during the regional anesthesia because of relaxing medication. Notice the ultrasound machine beside the patient. This machine will be used to look inside the body using sound waves at frequencies we cannot hear. Notice the block tray. These are the tools that your anesthesia provider will use to place your nerve block. The type of regional anesthesia you receive will depend on the area of surgery and the duration of pain relief the surgery requires. The nerve block may be placed at the neck to block the shoulder, in the middle of the thigh to block the knee, or in the back to block your abdomen or chest. Regional anesthesia can be placed all over the body to block areas that require surgery. All nerve blocks can be divided into two groups, a single shot or a continuous catheter. Single shot nerve block is the placement of a needle and medication alone given through the needle to block the nerve. These blocks last 12 to 24 hours before their effect starts to wear off. A continuous catheter nerve block is the placement of a thin plastic catheter through the needle after medication has been placed at the nerve. The catheter is then secured with a dressing and connected to a pain pump after surgery. Now it is time to head to the OR for surgery. During surgery, you will be monitored throughout by your anesthesia provider and given meds to try and prevent nausea. The nerve block you will have received can only be expected to treat 60% of your pain. Sometimes the nerve block prevents higher percentages of pain, but this should not be expected. Any additional pain will be treated with pain medications during and after surgery. After surgery, you will be taken to the recovery area. You will be monitored there for 45 minutes to an hour. If you receive a continuous catheter nerve block, you will be connected to a pain pump. As you awaken, be sure to communicate if you have nausea or pain. Any nausea or pain you may experience immediately after surgery will be treated here. Surgery requires that you stay in the hospital. You will be started on a multimodal pain medication regimen. This is a combination of drugs that work at different locations in the body to effectively combat pain. These medications, along with your nerve block, will help transition you through the next few days. If the nerve block alone is working well enough for your pain, it is okay to refuse these medications. However, if you are experiencing pain above and beyond what the nerve block covers, it is recommended that you take the medication offered. Whether you go home the day of surgery or stay in the hospital for a few days, the surgeon will send you home with a prescription for pain medication. If you will be going home with a continuous catheter with pain pumps, you will be educated on the pumps and the removal of the catheters at home. When the infusion is complete at home, you can remove the peripheral nerve catheter. First, stop the infusion. Second, wash your hands. Third, remove the adhesive gauze over the tubing. Fourth, slowly remove the catheter by pulling it from the skin. It should come out easily with gentle pressure. 5. Apply pressure to the site for 5 minutes. 6. Apply an adhesive bandage. 7. Inspect the site for bleeding, redness, or swelling. If any of these symptoms occur, please notify the phone numbers listed on your education.
LifeLink Anesthesia is changing the status quo of healthcare by providing the highest quality anesthetic care to our patients. Thank you for taking the time to watch this presentation. We consider it an honor to serve you.